Fit and young people with no symptoms are collapsing. This is the harsh reality we're witnessing far too often. Headlines showing young, seemingly fit individuals collapsing on camera, while playing, or even during workouts. What's happening to our youth? The numbers are alarming. 1 in 5 heart attack patients in India is under 40, according to the National Heart Institute. Younger Indians below 40 are twice as likely to die of heart attacks compared to their Western counterparts, says the Indian Heart Journal. And in a 2023 AIIMS Delhi study, 28% of all heart attacks occurred in adults under 45. Why is this happening? A big culprit is poor lifestyle, the real pandemic. According to the Indian Heart Watch study, 80% of young adults already have at least one cardiovascular risk factor. Just sitting more than 6 hours a day can increase heart attack risk by 20 to 30%, as shown in Lancet Global Health. Add to that ultra-processed foods, which the BMJ linked to early atherosclerosis in 2023. And we can't ignore the silent killers: poor sleep, high stress, alcohol, and smoking, all damaging the heart even without showing symptoms. Then there's unregulated exercise, the hidden danger. Sudden, intense workouts can trigger heart attacks, especially in people with hidden risk factors. The Indian Heart Rhythm Society, 2023, reports that most gym-related cardiac arrests happen without any warning signs. Combine that with pre-workouts, steroids, and fat burners, you get a much higher risk of arrhythmias and clots. And yet, no ECG, no screening, just lifting heavy. That's not fitness, that's gambling with your life. Genetics adds another silent layer. If a close relative had a heart attack before age 55, your risk of developing coronary artery disease doubles, as shown in the INTERHEART South Asia study. Around 30 to 40% of South Asians have elevated lipoprotein A, which promotes plaque buildup and blood clots, even when your LDL cholesterol appears normal. Yet LPA isn't checked in routine lipid tests, it needs specific testing and often goes missed. And when it comes to sudden cardiac death, some people carry invisible heart conditions, a normal ECG, no cholesterol problems, yet they remain at high risk. These are inherited syndromes like hypertrophic cardiomyopathy, Brugada syndrome, and Long QT syndrome, which can lead to fatal arrhythmias. Screening becomes critical if there's a family history of sudden unexplained death, or episodes of fainting, seizures, or sudden collapse, especially during sports or sleep. Remember, genetic arrhythmias don't knock, they strike. Now add the post-COVID factor. Studies like Nature Medicine, 2022, show that COVID-19 increases the risk of heart attack, stroke, and blood clots, even weeks after recovery. That's because SARS-CoV-2 causes inflammation in blood vessels and increases coagulability, the tendency to form clots. Even mild or asymptomatic COVID has been linked to silent heart damage in many individuals. Some worry about vaccine-related clots, but the data is clear. VITT, vaccine-induced thrombosis, is extremely rare. For AstraZeneca, rates are 7 to 10 per million doses, that's about 1 in 100,000. For Pfizer and Moderna mRNA vaccines, it's even rarer, just 0.05 to 0.2 per million doses, and slightly higher with boosters. Compare that to the clot risk from actual COVID infection, which is significantly higher. The vaccines are not the threat, the virus is. So why are heart attacks rising among the young? It's not just one reason. It's a perfect storm: poor lifestyle, hidden genetic risk, high-intensity workouts without screening, lingering effects of COVID, and ignored family history. If in doubt, consult a cardiologist before an event makes the first move. Because the truth is, young heart attacks are no longer rare. They're rising, silently, rapidly, and globally. Prevent first, treat later, live longer. Subscribe to Preventive Cardiologist for more such evidence-based heart health guidance.